Over here on the left side of the graphs window, we have the treatments area of AcuGraph. And here in this 3x3 grid, we have the 9 different treatment types that are built in. Starting with the basic treatment here in the top left, this basic treatment will address each one of the meridians individually. And as you roll over each one of the points, it will highlight the meridian that that point is going to treat. So you can see here that pericardium 6, for example, is being recommended because the pericardium channel is split, and it highlights the pericardium channel in yellow to show you that it will affect it. So we have the point, we have the reason the point was chosen, and then clicking on any one of the points will bring up an illustration showing exactly where the point is located, as well as giving the attributes, the TCM actions, indications, needling information, and any cautions that are associated with treating that acupuncture point. This makes it a fast, easy way to give your patient a preview of their treatment to show them exactly where they'll be treated that day for that graph. So that's the basic treatment. The advanced treatment style uses fewer points to accomplish the same results. So for this particular graph, the basic treatment will require 8 points, which is these 4 points treated bilaterally. If we go to the advanced treatment, then it's only requiring 6 points, which is 3 of them treated bilaterally. And then the expert treatment protocol not only looks at today's graph, but it also looks at the patient's history and makes recommendations based on the common imbalances that seem to happen most frequently with this patient. It'll also give auricular recommendations, herbal recommendations, home care, and custom recommendations, all included in this expert treatment protocol. It's a pre-made protocol ready to go using intelligent analysis of the patient's history and current graph. If we click on the ear, we get auricular treatment points, again based on today's graph, so it will show us which points need to be treated on the ear. And using the auricular points is a wonderful adjunct to using the body points to balance the graph. And here in the ear picture, you can flip it back and forth so that you can get both sides and get the illustration exactly the way you want to see it. Next, the back shoe point treatment style. This will only treat the back shoe points based on the imbalances. This is really useful if you happen to have the patient face down on the table for some other type of treatment, and using just the back shoes, you can get wonderful results. We also have the divergent channel treatment protocol, which gives you a 3-dimensional approach to balancing, upper to lower, left to right, and front to back, all included in one protocol. When we click on the spinal protocol, then it shows us the areas that might have spinal issues. And if you're doing body work, Tui Na, if you work with a chiropractor, then this will tell you the areas that you may need to focus on. And it's color-coded. It takes the spine and it color-codes red the areas that are most likely affected by or responsible for the imbalances that you're seeing in the graph. So as you simply roll right up the spine, then it gives you the information. In this particular case, we can see that the T8 vertebra is most likely affected. And it will not only tell us the channels that are associated with it, but it will also tell us the muscles that are associated with those meridian imbalances. So if you're doing body work, it gives you a really complete picture of what may be going on structurally with the patient. Then the herbal protocol uses the AcuHerb technology that's built into AcuGraph. Here it gives recommended herbal formulas, and in this case, for this graph, there are 4 possibilities. And then it gives a score going down the side here. Each one of them is ranked based on how likely it is to help this patient. So when we look at the most highly ranked one, in this case, it's going to affect that excessive lung channel. And if we click on it, it will tell us not only does it affect the lung, but it also affects the metal element. And as we found out when we looked at the 5 elements chart, the metal element was the most disturbed because it is clearly the most excessive element. So using this particular herbal formula may be a great fit for this patient today. To find out more about the formula, simply click on the herbal name, and it will give us the herbal formula window where we can read about the therapeutic actions, indications, both TCM and modern, as well as contraindications and comments and dosage, all right here along with the supplement facts and ingredients, and even the pronunciation of the formula name.
Yang, Yin, Qing, Fei, Pian.
Now, if your patient happens to be taking some kind of a prescription medication, then you'll want to click the View Interactions button. This will bring up all of the ingredients that are in that formula that may have an interaction with a prescription drug. And then you can look at each one and find out what interaction it has. So for example, if your patient is taking an anti-diabetic medication, then this formula may not be indicated. And so you can drill on down, right down into the class of drugs, the types of drugs, and you can get even the names of the drugs in red. So if your patient's taking any of these, then you know that this formula is contraindicated. So it helps you prescribe more safely and with better information. If you decide that you want to prescribe this herb for the patient, simply click on the number of bottles that you're going to prescribe. And now it has recorded in the notes for today's treatment that you prescribed that herbal formula for the patient, and it puts a check mark here to show you that you prescribed the herbs for that formula. And then last but not least, we have the custom treatment recommendations. And here it will give you the opportunity to record recommendations to pre-program them into your AcuGraph system, and then based on the graph results, it will put up the recommendations on the screen that you've already pre-programmed. So if you have a particular herbal formula or an exercise or dietary recommendation, perhaps some points that you like to use for particular imbalances, just program it in. It's fast and easy, and then they will come up under the custom treatments in the future. So there's the treatment window, and it gives you lots of flexibility to choose exactly what you want to do. Ultimately, as the practitioner, you choose how to treat the patient. AcuGraph just gives you better information to choose from.